So now we are going to move into our oral abstract presentations and awards. We had over 50 abstract submissions, and the following presentations were selected to give an oral presentation. These presenters should be honored to be selected from what we felt were very powerful submissions this year. So I'm going to call up our 4 presenters: Dr. Alexandra Piselli from Georgetown University, Dr. Jiang Zhang from Rutgers University, Dr. Genia Micheli from University of Toronto, Canada, and Dr. Sarita Pathak from New York University. And you can all join on the podium. And if Dr. Piselli first. Dr. Alexandra Piselli will be our first speaker. The title of the presentation is Assessing Attitudes and Understanding After Ovarian Tissue Cryopreservation, a Follow-Up Telephone Survey.
All right, hello. Okay. So my name is Alexandra Piselli. I am currently a 4th year at Georgetown University School of Medicine. And like she said, project title is Assessing Attitudes and Understanding After Ovarian Tissue Cryopreservation, a Follow-Up Telephone Survey. Before I get started, I just want to thank the committee for selecting my research to present this morning. And this project was done in conjunction with the NIH Children's National and Georgetown University School of Medicine. So I have nothing to disclose. Yes. Okay. So I have nothing to disclose. And then just as some background, American Society for Reproductive Medicine in 2019 declared OTC as no longer experimental. So the long-term outcomes of this procedure are not yet known, but there have been some studies that looked at patient attitudes toward OTC after the fact, most of which that have been reported have been patients that had OTCs after the age of 18. But there was one study that reported the attitudes of 4 patients who underwent this procedure as minors, but none have interviewed their guardians. So the aims of this study was to follow up with patients and guardians more than 1 year out from their OTC to assess experiences and attitudes toward OTC, determine the impact of cost on tissue storage, and develop recommendations for follow-up in the pediatric patient undergoing OTC. Our study design was a cross-sectional follow-up telephone survey with a cohort of patients who had undergone the procedure at Children's National in Washington, D.C. between the years of 2013 and 2022, between the ages of 0 and 35 years of age. They were onboarded through 2 IRB-approved protocols, and the questionnaire was developed by the Pediatric Initiative Network of the Oncofertility Consortium. Our materials and methods basically were a telephone interview was conducted, data was collected into the REDCap data survey instrument, and then statistical analysis was performed. There were 75 Children's National patients who had undergone OTC between the years of 2013 and 2023, with 60 being deemed eligible as more than 1 year out from their procedure. Of those patients, 54 had had their OTC prior to the age of 18, and 6 had had their OTC between the ages of 18 and 35. 20 patients were unable to be contacted, resulting in 40 surveys conducted. 13 were the age of majority, 27 were minors, and 3 adult patients had passed. So 10 total patients were interviewed and 29 guardians due to 1 guardian declining the survey. So this is just a further breakdown of the population. You can see the various primary diagnoses of the patients and that the age range was from 3 to 28 years old. The median age at follow-up was 16, with the median age at OTC being 8.5. At the time of contact, 72% of patients were in remission, and the median time to follow-up was 3 years. So all of the rest of the slides will pretty much look like this, with the top red box being the question that was posed, and then the bottom red box being the quote that either a patient or parent gave directly as their response. I will not be able to read all of these quotes, but it just kind of further contextualizes the information, so I thought they were important to put in there. So, when asked at the time of OTC what was the initial intent for the cryopreserved tissue, 100% said fertility preservation. And then when asked if you are not trying to become pregnant now, do you want to in the future, 100% of patients desired future pregnancy, with 70% desiring future tissue use, and one not believing they would use the tissue, but it was because she was able to become pregnant naturally. 20% were unsure, with a strong emphasis given for conceiving naturally. And then desiring tissue use often depended on outside factors like development of primary ovarian insufficiency, occurrence of tissue discard, and if they were able to conceive naturally, like I just said. Guardians had more mixed results due to being uncomfortable responding for their child. So an important part of this question with parents is that it's not their child having expressed to them their desire to become pregnant. It was the parental belief that their child would become pregnant. And a lot of guardians were uncomfortable answering for their child in that scenario. And then of note, 0% of parents believe their child would not use the tissue, highlighting the parental belief that tissue storage provides options that could one day be beneficial. So, just an example of a quote that was given. One parent stated, "My child is aware she had an organ taken out, but does not know the purpose. We are unsure if she will use it, but we are happy to have given her that chance." When asked, do you know how to use or access your tissue? If you wanted to access your tissue, how would you proceed? Despite extensive counseling, disseminations of copies of their consents and contract with the storage facility, and available financial assistance options, 56.8% of total interviewed did not know how to access the tissue, which was defined as not being able to articulate how to access the tissue and desiring a flyer or follow-up appointment. Regardless of stated understanding, 70.3% of interviewees desired follow-up information on tissue access. When asked, have you had difficulty paying the storage fees for your cryopreserved tissue? 26% of guardians and 40% of patients endorsed difficulty paying for storage. Of note, during this time, 4 patients had their tissues discarded, and none of them informed hospital staff of the loss. Some common threads in non-payment were loss and lack of communication. There was, as far as loss, this was storage facility contact loss, either due to emotional strain at the time of procedure or interstate moves. And then lack of communication in that payment difficulty from the patient side was not communicated to the storage facility or hospital staff. When asked why they felt that they couldn't communicate that to either of those parties, they stated embarrassment and not being able to pay, denial that their tissue would actually be discarded, and then stated lack of financial assistance information. Those who denied payment difficulty, which was about 26 patients, did state some positives in that they felt security when they had opted for 10-year payment plans at initial procedure, and also automatic bank transfers, so it was always something that would happen. But some concerns were still brought up in that at the age of 18, the storage bill would be transferred from the parent to the patient. And that is a time marked by financial transition as people are going to college for the first time, getting their first job, and that was stated as something that was concerning. There were also concerns in that some people were worried that they would no longer be able to qualify for the payment plans. And a lot of parents stated that was how they kind of allowed the cost to be incorporated into their life. So there was fear about losing that assistance. When asked a follow-up, how do you feel about the decision to remove an ovary and store tissue? If you could go back, would you make the same decision? Some patients expressed regret due to being unable to pay for storage. 100% of patients would recommend it to a friend, and parents were more conservative with their answers, as they often stated it was a decision that was individual to parents and families. The one patient and one guardian who expressed regret at having an OTC were directly associated with payment difficulty and tissue discard. When asked, would you recommend storage of ovarian tissue to a friend in a similar situation, 92.3% of respondents said they would recommend it to other families in similar circumstances. They cited wanting to give other families and children options for childbearing, and those who answered against recommendation were connected to previous answers of regret and payment difficulty. Though not all who regretted the procedure would not recommend it, it depended on cost and individual family circumstances. So here are some quotes kind of representative of the responses of patients to that question. We didn't know if the chemotherapy was going to cause my ovaries to stop working, but when it did, I was grateful for the frozen ovary. I probably wouldn't do it again. I wouldn't have missed the storage fees and lost the tissue. It was the right decision and a way of being responsible and proactive. On the other side, here are some answers from parents. The parental answers often were more bittersweet in tone. Some had already recommended the procedure, saying that through having a child with leukemia, we've met so many families trying to make the same decision, we always recommend it. Some focused on cost. I would recommend it if they could afford it. The individuality of the decision between families was also emphasized. We would explain our rationale, but it's more of a personal choice within a family. And then the difficulty of having to elect for a child to go through an additional surgery when they were at such a vulnerable time. She underwent so many surgeries, it was hard to see her go through more. I wouldn't recommend it. So some conclusions coming out of this. Our findings are comparable to what's been reported in adult cases. All OTC patients at Children's National underwent the procedure for fertility preservation. Most patients and parents and guardians desire tissue use, though knowledge of access to that tissue is suboptimal. And the majority report satisfaction with their decision to undergo OTC, except in instances of financial difficulty. Of note, the 4 patients that had their tissue discarded came to about 7.4% of our total eligible cohort, which is similar to other papers that have actually reported this year, an 8.9% discard rate due to expensive storage fees. Some limitations of the study. The questionnaire was not validated. The study was not a rigorous qualitative study. Time to follow up after OTC was variable, making less uniform responses. There was a small relative sample size, and many patients were minors, resulting in parental responses serving as surrogate answers for patients. Despite these limitations, this study is the first to follow up on attitudes in parents of minors who underwent OTC in a pediatric setting and expands on existing literature on adults who were minors at the time of OTC. So some considerations coming out of this. We don't feel that the level of initial counseling at Children's National was insufficient, but we do want to focus more on revisiting that information at follow-up. The initial counseling continued to emphasize tissue status, payment schedules, payment assistance, tissue use, and at annual follow-up, revisiting that information to decrease the risk of tissue discard and therefore patient regret. We've established a follow-up protocol at Children's National now that's connected to all of our patients to come back annually, and are in the process of getting all 75 to come back to readdress those questions, make sure they're plugged into paying, and also just kind of talk to them when they're less pressured because they haven't just undergone the procedure. Considering materials with easy graphics at initial counseling, and then tracking when patients reach 18 years of age, as that's a time marked by financial transition. Other considerations are advocating for insurance coverage of the storage fees due to the increased time to use in the pediatric population. Advocating that storage facilities be conservative with ovarian tissue discard, and then also considering foundation support, which is something we've also done at Children's National, being able to start a fund for patient storage support and people who need those, that financial help. And then also considering direct communication between providers and the storage facility. So, I just wanted to leave you with this one last quote. I feel like it really drives home the point of this talk. Maybe if we had gotten on a payment plan, my child would still have the option to be a mother. I am afraid to have that conversation when she is older.
Do we have any questions for our presenter?
Question and then possibly like a comment. As far as your patients, were you guys offering any sort of philanthropic support for the procedures at the time that these patients would have had the procedures? And do you feel like if not, that would have changed some of your outcomes, since most of the regret seems to be financial?
So when you say philanthropic support, are you talking about like the financial assistance programs like for
No, so like
no,
if there
okay.
was funding support for the uncovered family and patient costs as far as surgery and processing?
So I do know that all like OTC procedures that were done at Children's National were coupled to another procedure, so that the cost of the anesthesia and everything was already covered by insurance through the separate procedure that was occurring. So in that way, there was, I believe that they didn't have to pay for the procedure.
So Holly, for storage, so we did the procedure for free. The freezing was done for free, and the only responsibility the family had was storage payment.
Okay,
and we gave them the Avernus purse, you know, and then when we found out our first tissue discard, we discussed with ReproTech, and we told them, do not discard tissue until you call us and tell us. And we were able to pay for people who were behind in 2020. And then this kept happening. So I just want to, this is like a big call to arms here. We did start a fund now. We got a charitable donation. But I think the biggest thing from this study is the patients are embarrassed that they can't pay, so they don't tell us. We could have helped them.
Yeah,
and they didn't tell us.
I think the one comment was maybe with all this work, I mean, we almost all, I think, send our tissue to ReProtect. So maybe setting something up in the contracts for ovarian and testicular tissue, like if the patients can't pay, is there an automatic resource that they call all the institutions, right?
Yeah.
That they would, and
Absolutely.
then we could reach out and see if we could help.
Yeah, yeah,
For everyone or just? I just mean like for everyone. Like if
Yes,
that became
I am going to interrupt that conversation. I think we have the point there. So we're going to go to the next question.
So I just wanted to thank you for this work because in the Children's Oncology Group Long-Term Follow-Up Guideline for Premature Ovarian Insufficiency, we had intuitively, as a group, embedded in our special considerations to have a yearly conversation with survivors about the status of their tissue preserved, but we didn't have anything to refer to. It was sort of an expert opinion. So really looking forward for your paper to be published so that we can reference it. But it's something that I think is extremely important for this conversation to happen yearly.
Thank you.
Thank you so much. I think this is very important, and I really appreciate how you brought the point that we need to continue these conversations annually and talking about storage and making sure that families know where things are held, and because I just think that's so important. One question I did have is, did you reach out to any families who had a child who passed away, and did you get any information about their regrets or not?
Yes, so one of the patients that we did reach out to, they actually, there was another quote that I had to remove for time, but they stated that they did not regret their procedure just because it kind of got them more involved in advocacy. This one particular mother donated the tissue afterward and felt really empowered that her child got to even, you know, posthumously help other people that were going through the same thing her child was going through. And then she actually became very involved with the program at Children's. So from parents who had a child pass away, there wasn't any negative feelings. It was all we were really trying with the hope for the future, and they didn't regret it.
Thank you.
We're going to take one last question. Yasmin, I won't be able to take your question. I'm sorry.
Thank you so much for this eloquent work. I just wanted to make a comment. You know, I think building on what Wasim said about the long-term follow-up guidelines, I think as a field, we're really missing the boat because those guidelines start at 5 years. And so there is a big chunk of time between when kids are going through these procedures and their initial consults where these conversations are potentially not happening at all and no one's taking ownership of the conversations. So I think we really need to think about that as a group and how we can address that gap.
Thank you. Thank you for your provocative presentation. All right, we're going to our next.